Why doesn't Medicare cover dental and vision? This is a question I get quite often, especially from folks that are retiring and going off of group insurance. The dental coverage should be fairly obvious, but for some reason the vision isn't, and maybe it's because it's a bit convoluted. Hi, I'm Bob Vineyard, your Medicare expert with the Georgia Medicare Minute, and we're going to look at vision coverage today under Medicare and not under Medicare. So the simple answer is, does Medicare cover vision? Is sometimes it does and sometimes it doesn't. So let's dig into that a little bit more. Your regular eye exam, it's called a refractive eye exam to see if you need glasses or if you need your glasses or contact prescription changed. That's not covered by Medicare in most cases. We'll get into that in just a little bit. Medicare does cover, it doesn't cover routine vision care, but it does cover treatment of certain things such as cataracts, glaucoma, macular degeneration. There's a few other things, but illnesses that affect the eye are generally covered by Medicare, both the diagnosis and the treatment. So that, you've got that part of it. Now, if you are being monitored for glaucoma, if you're being if you have cataracts that are being watched, then part of that exam may be covered by Medicare. I hate to be so evasive in this, but it's kind of like walking through a minefield. Well, if you do this, it's covered. If you do that, it's not. So the biggest thing is, it depends. But it seems like there's a lot of folks, a very high percentage of folks, 60% or more, that once they reach Medicare age, they're going to have cataract surgery at some point. It's relatively simple and safe. It's relatively inexpensive compared to other surgeries, but you're still looking at anywhere from $3,000 to $6,000 per eye, depending on the procedure that's done, the type of lens that is implanted, and so forth. So considering you come with two eyes, then just kind of double those figures. The good thing about original Medicare and a supplement plan, and I have over 500 clients in Georgia, and every one of them have original Medicare and a supplement plan, and a good number of them have had cataract surgery. The good thing about original Medicare and a supplement plan is that type of surgery is done on an outpatient basis, which means it falls under Medicare Part B, which means that your liability for the portion of the surgery that is covered by Medicare, your liability is limited to the calendar year deductible, which in 2020 is $198. Now, I say the portion of it because Medicare will cover for removal of the existing lens and implanting a new lens. There's technical terms for it, but basically it's a standard lens and a premium lens. A standard lens means that you're still going to need to wear glasses, or you're going to need to wear glasses for reading. You may not need glasses for reading right now. I don't. I need them to see the street signs when I'm out there driving, but I can read just fine without glasses. I don't have cataracts. My wife just found out that she's going to have one treated here in a few months. So that's why I'm kind of looking into this right now. But the regular lens is covered by Medicare, is usually covered by Medicare. If you go with the premium lens, which means that you can see far away as well as close up without any special glasses, reading glasses or otherwise, then you'll have to pay the difference between the standard lens and the premium lens, and you'll have to pay that in cash. And I think that's around $1,500 or so. Again, that's per eye. So it's something to consider. Do you really want to pay an extra whatever it is, $1,500, let's say, times two, $3,000 to avoid wearing reading glasses. Well, that's a personal decision. And, so it's just, like I said, there's just different things to look at. One of the things that Rachel is trying to get her head around now is one eye needs to have surgery. The other one has a cataract, but it's not too bad and it doesn't need surgery. So does she need and want to have one lens corrected and let the other one be as it is, which means involving a special prescription, one for the right eye, which still needs vision assistance, and another one for the left eye. She's a special lady in more ways than one. So we're going to be going through that over the next few months. But in any event, as far as routine vision care, generally not. If you're diabetic, or have some other issues, then part of your eye exam may be covered. If you are developing cataracts or glaucoma or something like that, then you've got some coverage there. So, like I said, it's a minefield, and your doctor should know, yeah, this is covered by Medicare, this is not, and since this is not, if you want to upgrade or this or that and so forth, here's the price. So it's one of those things that you really need to talk to your doctor about, as opposed to just saying, well, gosh, all my friends are having cataract surgery, I guess I need to have it too. No, you don't want to go down that road. So this is Bob Vineyard with your Medicare Moment. You take care and have a great day.